Coming up on the Naked Doctor Show, medical cannabis is finally in full swing in Arkansas. But how does it all work? From the doctor to the dispensary, we take you through the entire process. It all starts right now on the Naked Doctor Show.
Hi, welcome back this week to the Naked Doctor Show. I'm Dr. Tammy.
I'm Lauren.
We have a great show for you today. We've done a few cannabis shows, but this is probably by far the best cannabis show because we have a lot of new information for you. We have a guest on today, Buddy Wayne from the Relief Center.
The dispensary in Northwest Arkansas. So
we're going to take you through the whole process. We're going to show you a patient coming into the office, getting her card, receiving her card, going to the dispensary. Going to show you all through the dispensary as well.
So let's talk about that, like our process. Because first, whenever somebody is wanting to get their cannabis card, their medical marijuana card, they may be intimidated, and they'll go on our website and kind of read up on some information or fill out the form on there. But yeah, it's as easy as booking an appointment and understanding what the qualifying conditions are and stuff, and then kind of let's take them through our process of what we do.
And they can book online at
healingartcenters.com.
And they can also call the office, and you can put the number down below, can't you? And then all they do is schedule an appointment, come in, and when they do come in, what we're going to do is review your medical records, and you'll get a full exam if you're a new patient. If you're an established patient, then we should already have the records identifying that you have one of these certifying conditions, and there's 19 different conditions. We're pretty strict about, having medical paperwork, medical records if you've been diagnosed with one of these conditions. And some things can be diagnosed in the office, or we can send you out for x-rays or go back and get other, records. But at the time, we really want you to have your medical records for the certifying condition. And then after the physical exam, if that matches up with a condition, then we fill out this letter, basically. And again, we're not prescribing, we're not even recommending cannabis. All we are saying at our office is that you have this condition. So the conditions range all the way from cancer down to fibromyalgia, Alzheimer's disease, all the way down to muscle spasms, chronic pain, PTSD. And then you take this letter and you submit it to the Arkansas Department of Health, which we walk you through that whole process, make it really easy.
So you can either do this online, which is, I would say, is the easiest method. I know a lot of people aren't really in the digital age, and some people are old-fashioned and want to mail it. But for me personally, you just upload a couple of documents and then fill out some information on like your name and address and stuff like that, things that match your state ID. And typically you get a card back within like
quick, a week,
like 2 weeks.
And
you pay the $50. There's a fee through the state for like $50 for the filing fee, and it's a quick return. And then you just take that card, and then you'll have access with the card and your ID. You'll have access to go to the dispensary. I know next, Buddy Wayne will tell us more about kind of that process and what we do there. But yeah, so when they come here, they talk to you for what, 10, 15 minutes. It's not it's not intimidating.
It's easy.
Don't be scared to come in. And if you're curious about what the qualifying conditions are, you can go, you can find that stuff online, or you can call the office, and Lainey can help you with that information. But there's a lot of qualifying conditions, and I think that if you feel like you're one of the people, or if you have something, then don't be scared to ask questions and see if you do have a qualifying condition, and because obviously we want to help you get your medicine. So,
and as a new patient, sometimes it takes a little bit longer, especially if we have to order x-rays or labs or anything like that. So and then you might not get your card right away until we actually make that diagnosis. So I want to kind of have that expectation that people come in if they've not been diagnosed or don't have records, that there may be a little bit more of a process there. Most patients say that they have used this as medicine, they've used from other states, or they're here just getting legal. And so I think it's, just anecdotally been wonderful for people, truly, and we'll talk about that a little bit more later, but a gateway off of stronger drugs, opioids, alcohol, and just as medicine. It's a truly amazing
I think
substance.
I find totally, and I feel like the people who are the most worried about this process are kind of more the baby boomer era of people, because they're like the ones who went through the stigma of what's
right.
Even though they're probably the ones.
Madness.
Yes.
And everyone trying to control
shame,
shame them. Yeah.
I feel like there's a lot of people in that, baby boomers who have been using it for so long and been scared to be caught or busted and get in trouble, that it's like that's trauma in itself.
Yeah.
And trying to unravel those things, and so just know, like, it's the process is getting easier. It's not scary. You don't have to be worried about coming in here or getting caught or being on record or anything like that. That's gonna keep you from doing it. And also, Dr. Tammy is very not intimidating. She's very sweet. So if you have questions about anything, she's easy to probably. I mean, I'm biased, but she's like easy
Oh,
to
yeah,
talk
she
to
always
talk
thinks
to.
I'm great. She always says. I just told her a few minutes ago, she was going on about how wonderful I am and something about rose-colored glasses. But yeah, it's interesting. The majority of our patients are very sick and really need this as medicine, and they are professionals, they are pastors, they are, people that work out in the community, and these aren't just people trying to get high. I mean, these people really do need this as medicine. And I've known personally friends and family members that use this as medicine, and it keeps them off opioids, keeps them from drinking alcohol excessively. And there's no lethal dose of cannabis. There is, well, I guess there is if you ate 15 pounds in 15 minutes, but nobody can do that.
Yeah. I feel like if you ate 15 pounds of anything in 15 minutes, you'd probably die.
Yeah, it doesn't affect the liver or kidneys. Some people are asking me, just this weekend, some friends were asking me about vaping, because there's all this buzz about, is vaping dangerous? And, my thought on that is it's the addictive chemicals that they put into the vape juices with the nicotine that are the problem. So, a lot of fear and concerns about the best ways to use this. So, and we've done some other shows and we've talked about that, and we can do some more in the future. Buddy said he'd come back. So
definitely.
I want to do a little plug for the book, The Cannabis Solution. And as I was doing my research whether I was going to do these cannabis certifications, I realized that this actually is a medicine and it's been used for thousands of years. So you might want to check that out.
Check out our book. There's so much information on there, even if you've been a pothead or whatever your whole life and you think you know everything about marijuana or cannabis. I promise you're going to learn something in that book. It's great, and there's so much information. She put a lot of time into it, so check that out for sure.
Go to Amazon.com to get that, or you can come to the office and pick one up. All right, we're going to take a little break, and we'll be back with Buddy Wayne from the Relief Center.
I fell 18.5 feet, scattered my right ankle into 23 different pieces. And that, of course, affected my knees, which affected my hips. And then I have a back injury and a neck injury and a shoulder injury. And I was in severe pain most all day until I could actually lay down and get off of my body. The stem cell therapies within hours actually turned around to where I felt like almost 90% of the pain in my body was gone. I could walk. I could walk without pain. I then came back and did a stem cell IV, which came in and affected all of the other parts of my body. And at one time I was a smoker. Since then I have felt a large difference in my lung capacity, in my breathing, in my stamina. It's the most amazing thing that I've ever come across in my life. And one of the things that I say is you will love Dr. Tammy. She is the sweetest person you'll ever meet, and she is not your typical doctor. She makes you feel like you're at home. She actually gets to know her patients, knows their lifestyle, and tries to work her treatments with your lifestyle so that you are happier and more productive on what you're doing.
Hi, welcome back to the Naked Doctor Show. I'm Dr. Tammy.
I'm Lauren.
And we have Buddy Wayne with us today.
Welcome,
And
buddy.
Welcome. Talking about cannabis. And we've done a couple cannabis shows talking about cannabis as medicine and what the patient process is in Arkansas.
Mm-hmm. Now we have dispensaries, so
Yeah.
kind of wanted to give you a rundown on, or ask you what it's like for a customer to come in there and kind of take us through that process.
Kind of destigmatized too, because everyone, I'm sure, is curious where the locations are and how to get to you and what that's going to be like and what the wait time is and what the process is. So just kind of give us the rundown on that.
Well, we're really happy to watch the industry change as it has and to help your viewers. All of us, I think, grew up in a time where we knew that this was an illegal activity. It had this great negative stigma. We were told that it could lead to other drugs or other terrible things. And so we always have that in the back of our mind. And it's kind of in our subconscious as we visit dispensaries today. So when we go to dispensaries, I think most of the public would be very surprised to find that they're actually very similar to a normal business, a typical retail outlet. If you think of Walgreens or CVS, where people go to get ordinary medications every day, when you go there, there's no particular security risk or otherwise. People hand to you your medication, you pay for it, and you leave without really being concerned. That's where we're going in our industry. That's the future of the cannabis industry, and that's the direction of the Relief Center dispensary out on McNally Road. So
That's almost Bella Vista, right? I've been told it's Bentonville, but sort of on the edge.
yeah, it has a Bentonville mailing address, but it's really outside of town in the direction of Bella Vista. And so, from 49, just exit at McNally Road, and you go a couple miles up McNally Road, and you'll see us. We're in a very attractive old white barn.
Cool.
Nice.
So it's really kind of fun.
So like somebody go in there, they come here, they get their certification, they take their card there. What does that process look like for them? When they walk in the door, what do they see? What does their process look like from start to finish?
Well, first they're greeted before they even get to the door with an encouraging welcome back greeting, because almost everybody's a returning patient. We have a number of people that might be in a wheelchair or a walker or other things, so we're able to help them. When they get there, they present their medical card and a government identification of some kind, and that allows them to enter the dispensary. So after we check the card and make sure that's valid, and they enter the dispensary, they get acquainted with a patient service consultant. And that patient service consultant becomes their best friend in the marijuana industry. They take a lot of time to really get to know the patient, find out what their true needs are. And that's a process that takes a certain amount of questions and conversation to really get to know the patient. And so that's the foundation of the systems that we use to begin to help people find medicine that's useful to them.
Yeah, one of the things that I think people think is, you go to the doctor, you get a prescription for something, but here we don't do prescriptions. She's just certifying that you have conditions. So that prescription aspect of it is something more so that your staff helps with, as opposed to, it's not really a prescription. It's basically like what strains or what product will help you most based on your condition. Is that kind of the case, like what your people help them with?
Oh, most definitely. Of course, marijuana comes in dozens and dozens of different forms. And so there's lots of choices for patients on how they might consume marijuana. And we have all those available. So one of the fun things about the industry is that there are several hundred different strains of marijuana, right? And each of the different strains has some different effect. And it might affect one person one way and a different person another way. So like any medication, there's a lot of individualization that goes with it. And so
that's why I say you wouldn't take blood pressure medicine for your high cholesterol. So it's very different for every condition. Didn't mean to interrupt, but yeah, I'm totally on board with that.
I mean, the truth is about medical marijuana, there's very little information right now because it's been illegal to study it. And although there are many books written of many diseases that it helps with that said, much of it is trial and error. Even for an aspirin or a Tylenol, for many of us, it's trial and error. Mm-hmm. We might try an Aleve, or we might try an aspirin, or we might try a Tylenol or 2 Tylenols, and we might find one works better than the other for us. And it's the same way with medical marijuana. It takes a little trial and error to tune it in.
Mm-hmm. And one of the things about medical is that the standardized dosing, right? You guys, actually, when you get 5 milligrams, it's 5 milligrams or 10 milligrams in an edible. So they get that consistency, correct?
Well, they do sometimes. It really varies because for people who, for example, will take a 10 milligram edible, usually in the form of something that's kind of like a gummy, mm-hmm. right? It tastes good and it has 10 milligrams, and that's a very dependable dose. It's exactly 10. On the other hand, if you vaporize marijuana flower, you don't know exactly the dose. Mm-hmm. And it's hard to tell because it doesn't hit you immediately. Mm-hmm. And as a result, there's a little trial and error and adjustment there for people, mm-hmm. right? So we have a lot of different methods of ingesting it. But this is a real telling part of our industry. Normally, if you get a Tylenol or an aspirin, you know exactly what that dose does, mm-hmm. right? But much more like alcohol, you don't know exactly what that dose is going to do to you that day.
If you've eaten, lots of variables out in the sun.
A lot of variables. So dosing is a really big issue for us, especially for people who are smoking it or vaping it in one way or another. Mm-hmm. And so much of that is trial and error. So some people, we do talk about the edibles. We talk about tinctures, for example. We also have a lot of CBD products that we also sell simultaneously.
Without the THC.
Without the THC.
They don't have to worry about drug testing and things like that.
Well, and it's not psychoactive.
Mm-hmm. Right.
So there isn't any issue with being under the influence of CBD. Of any drug, because mm-hmm. CBD is known to help with a long list of things like inflammation, mm-hmm. arthritic conditions, and a long list of other things.
Is there a limit to how much they can buy at one time?
That was my question. Yeah.
There is. It's actually a very high limit, so it really doesn't limit hardly anyone. But it's 2.5 ounces.
I wouldn't go there so quickly. It would be like, I'll take that whole wall of.
Well, you still have to consume it. You might be able to buy 20 bottles of tequila, but I don't think you could drink 20 bottles of tequila.
Right. So what is it? Is it 2.5 ounces?
Yeah, it's 2.5 ounces every 14 days.
Okay. And is there like a registry? Because some people are concerned that this is reported somewhere or that it's going to go against their disability.
Well, I understand that, and there is a record that the state keeps of everyone's allotment so that they can get the correct allotment. Mm-hmm.
Does that keep them from going to other dispensaries too because it's a state registry, or?
Well, they can go to any dispensary they want all the time. They never have to go to the same dispensary.
But she means like more than one in a day, basically.
Or do they have to, for their 14-day allotment, is there a record so that you can't go to multiple dispensaries and just start buying
There is a real-time recording, much like there would be at Walgreens when you mm-hmm. get your prescription. There's a real-time recording of the medication that's distributed. So you can't exceed the limitation provided by the state, right? So far, they don't share that information with anyone, right? So I haven't seen any examples mm-hmm. where anyone's been harmed by the fact that the state does keep track of your allotment. It also doesn't say what you've purchased. It just says the total weight that you've purchased. So no one necessarily would know whether you're consuming it at one time or another, because as you may know, marijuana stays in the blood system for a very long time. So you might consume it on a Monday, but it's still in your blood system on a Friday when you're, of course, having no effects from it. So finding it in the blood system isn't really evidence of use.
So we got a couple more minutes. Could we talk about what the waiting room process is, how many people are allowed in there, what your hours are, the online ordering system, because a lot of people don't know they can order online, and maybe briefly what the caregiver status is if a caregiver's buying for someone?
Those are fantastic questions. The waiting room process is, as of late, very simple and quick. Our average wait time is less than 5 minutes right now, and it has been for several weeks. When we first opened, we had longer waits, and now we have streamlined systems, including the online ordering system. Recently, we're having hundreds of orders every day through an online ordering system. That allows us to complete those orders while people are driving to the dispensary to come and pick it up. It's much easier for the patients, and it's certainly faster for everyone. And when you do it that way, you don't have to wait in any line at all, if there is a line. But most of the time there's not, because we can have 5 to 7, even up to 9 people ready to help patients when they come in the door. So part of our system is designed to flex up for the busy times so that we can handle whatever the crowd is that's coming our way.
So it's not delivery, it's just online and then pick up.
Right, it's online and pickup. Delivery will start in about a month.
Okay, cool.
What's the website if they want to go? Because would they come in first and establish with you first and then order online, or can they just go
Oh, they
online
can order
to
online anytime. There's a number of ways to handle that. They can go straight through our website, which is reliefcenternwa.com. That's easy to remember, but there's a couple of other systems.
RELEAF.
Right.
Yeah,
The
like
spelling
leaf.
is LEAF, right,
Okay.
like leaf.
Right, okay.
I'm glad you mentioned that. Also, we use an application that you can download on your phone called Leafly, which is L-E-A-F-L-Y.
I love Leafly. I've seen Leafly. Mm-hmm.
And it not only will help you with your online order, but it'll tell you all about the strain. It'll give you medical information.
It's amazing.
Cool.
I actually did some references in my book that I wrote, so yeah.
Yeah, it gets a lot of its information from consumer reviews. So it's like having clinical studies. And it's literally thousands of people that review individual strains. And their feedback is the foundation of that information. So Leafly's fantastic. You can just go to leafly.com, look under Bentonville. You'll see us there. You can click on what you want, sort of like Amazon. You build a cart, and off you go. You don't actually pay anything online until you get to the store.
Cool. And the caregiver status, can someone apply as a caregiver, and what's quickly what that process?
Sure, of course. We have people who are helping others. Sometimes there's a child, for example, that needs an adult caregiver, because we know the FDA has approved some uses for children to help them with seizure disorders, especially. So we also have caregivers that might be needed sometimes for the elderly or otherwise infirmed, where there are people who actually can come to the dispensary with a certification of a caregiver on behalf of a patient. It's all arranged through the state, and that way everybody can get their medicine.
Cool. And is there a price list on your website?
There is. If you go to reliefcenternwa.com, we have a price list there. We also have a price list on leafly.com, and we have another one on another similar site called Weed Maps. So you can see our prices all the time. You can see what strains are available. Any given day we have more than 40 strains available, and we have lots of other products as well that are all listed there.
So they can be prepared before they come in for price, and then cash only, right?
No, not for us. I mean, this is a big myth, and there's so many myths about security and cash only and all these things, but we actually take debit cards with no trouble at all. We have ordinary banking, we have ordinary payroll.
Awesome.
Arkansas is a step ahead of some of the states.
Yeah, that's awesome.
Yeah, we really just don't have those issues. We've taken steps to make sure that the patient can easily complete the transactions.
Good deal.
And insurance doesn't cover because it's a federally kind of blocked area so far. But like expense-wise, what are people looking at for average normal uses.
Black
as-
market versus,
Yeah.
you know.
Well, we're actually the only dispensary in the state of Arkansas that's making a dent in the black market, because we have grams cheaper than the black market, and we have eighths cheaper than the black market, and we have ounces cheaper than the black market, and cheaper than if you went to Oklahoma. And as a result of that, we're taking those patients, because a lot of patients would rather just be legal, right? Why would they risk an unnecessary
I hear that
problem?
all the time, all the
Right?
testimonials of how much it's helped, and they're just getting legal.
So we sell grams at $9, which is almost our cost, and we sell eighths at $34 and ounces at $250. All those are the lowest by far of anyone in the state of Arkansas. So we're leading the way to lower prices.
Cool.
Nice.
Good deal.
Thank you so much for being here
Thank
today
you.
and answering our questions. I hope you'll come back, because we have so many more questions, and I'm sure tons of people have more questions too. We have such a short time. I hate it. But anyway, please come back.
Yeah, thank you so much for being on.
Yes, thank you guys. We'll see you back here in just a minute.
A few months ago, I went to Dr. Tammy with some foot pain. I had inflammation on the tendons. She recommended PRP. And we tried it. A week later, I had no pain. Till now, I've had no residual pain. I think it worked very well.
At Christmas time, I went in and I saw her, and we did a stem cell PRP and in my hip and my shoulder, and it was like a week later, it was, I felt so good. I wasn't able to sleep with my arm up or anything because it hurt so bad to put my hand behind my arm, and the joint pain is all gone in both areas.
After using Dr. Tammy's services, I've been extremely pleased. I have nothing but good things to say about her, and I will continue using her in the future.
I recommend, if you're just feeling old, tired, and the daily grind is getting you down, just go see her. She's life-changing.
Hi, welcome back. Hope you've enjoyed our show today. We had so much great information.
Appreciate Buddy being on and giving us that
Yeah.
info and kind of walking us through that process. So,
he was awesome.
hopefully we helped you feel better about this whole process. And if you were waiting or kind of intimidated to even start the process or come get your card, just know it's really simple, and just book an appointment, and it's kind of just all easy going after that.
I had a ton of questions for him that I didn't even know, so I thought that was really great. He had a partner that stopped by the other day, and I was asking him questions. I'm like, wow, we really got to have one of you guys on the show to answer some of these. I've been to a dispensary in Colorado, and just out of curiosity, wanted to see what that was like, but didn't know if that kind of transferred here. What
Right,
that
if it was the
gonna
same.
look like. Yeah, so I'm really excited that that's going to be such a pleasant experience for people, and people can get their medicine.
Yeah.
So check us out. You book appointment at
HealingArtCenters.com.
and check us out on the Naked Doctor Show. We're actually changing our time to
Yeah, our time now is going to be at 12:30, and if you're seeing the show, then you already know that. But so our time slot has gone from 11 to 12:30 p.m. So
your
it's still
friends.
close, but
Yeah.
while you're eating lunch or whatever, just check us out.
check us out on the Naked Doctor Show, and Lauren always posts our shows on there too, so you can watch them in
Facebook,
perpetuity.
YouTube,
Yeah,
Instagram. Yeah, come
Naked
and,
Doctor Show.
and then come see us.
Don't forget, we love you. Thank you. Have a great blessed week. Mwah.
Thanks for watching.